In other health news, March is National Colorectal Cancer Awareness Month. Colorectal cancer is the third most diagnosed cancer, so all month long, organizations will be shining a light on the ways it impacts various communities and educating the public on the importance of routine screenings. Joining us now to help us raise awareness is board certified colorectal and general surgeon Dr. Cedrek McFadden. Welcome to BNC Live, Dr. McFadden.
Thank
We
you.
know that several Black high-profile men like Chadwick Boseman, the actor, have died from colorectal cancer. Tell us about the importance of these screenings in preventing and treating this sort of cancer.
Well, this is important because colorectal cancer is one of the few cancers that we can actually prevent. We can find these cancers either when they're much smaller or before they've had a chance to become a cancer, when they're still a small polyp, through a colonoscopy. And that colonoscopy is a routine screening test that we advocate that all people have once they've reached a certain age of 45, where we can find these polyps and remove them and prevent cancers from developing, which is why it's so important that we have not only access, but we have the education and we have the ability to have these tests performed.
So tell us about the screening options that are available.
Well, there's several. Most of us think of a colonoscopy as being the primary or the gold standard screening option. That's an outpatient procedure that takes probably anywhere from 20 to 40 minutes where you're given sedation. It's relatively painless. And a camera is inserted through the bottom throughout the entire large intestines looking for any abnormalities. If those polyps or abnormalities are found, they're removed, they're sent to the lab for further testing. Ultimately, that test itself, you go home the same day, you're able to eat whatever you like, but it does require some preparation the day before that keeps some people from wanting to have that test. But the other tests that we often hear about are the blood or the stool based tests that still require a prescription. But if those tests are positive, you still will be recommended to have a colonoscopy. So there are lots of options available, but ultimately, the best test to do is the test that the patient will actually have done.
And what are some of the warning signs that you may have or be at risk of having?
Well, the body sends signals to alert us that there's something that's not right. We often have people that will mention they have some bleeding that they say, oh, it's due to my hemorrhoids. But there are other causes of bleeding other than hemorrhoids, and often it can be cancer. This other signs or symptoms include changes in the bowel habits, whether that be in the shape, the size, or the frequency or the consistency of the stool. Or you could also have abdominal pain or cramping that's increasing in severity. People may often mention they have unexplained weight loss. They're losing weight and they're not even trying to lose weight. And those are some of the ways that your body's sending you those signs that something's not right and we need to be tested. But I'll mention that often there are no signs or symptoms, and it's only detected through routine screening examinations.
Is colorectal cancer something that runs in families like breast cancer or skin cancer?
Well, there is a genetic component, but unfortunately, most of the people that we see don't have that genetic link. If you have a brother, you have a sister, a mom or dad, a first degree relative, or multiple second degree relatives like aunts, uncles, and cousins, that could increase the risk that you could have colorectal cancer. So we advocate screening not at 45 in those patients, but screening 10 years before that family member was affected. So if mom was 39 when she was diagnosed with colorectal cancer, you're not waiting till 45. You're going to begin screening by 29. And so it's important that we do know our family history, that we talk about it because it can influence when we do testing and how often that testing is actually done.
And what treatment options are available once you receive a diagnosis?
Well, the treatment's really based on the stage of that cancer. And so when we get a new diagnosis of colorectal cancer, there'll be some x-rays or some CT scans or images taken to see if the cancer spread to any other areas outside of the colon, whether it be the liver or the lungs. There'll also be some testing of the specimen when removed to look for any involvement of the lymph nodes, because that can influence whether or not the patient receives, if it's a rectal cancer, chemotherapy and radiation up front. But in most cases, surgery is the primary mode of treatment, and it may be followed by chemotherapy and or radiation, depending on the stage of that cancer.
And what about disparities in health care? Is this something that's affected by that as well?
Absolutely. And unfortunately, we see that Blacks have a 40% higher risk of death from colorectal cancer, a 20% higher risk of being diagnosed with colorectal cancer. And it does come down to some of the disparities and some of the systemic racism that we see present, not just in healthcare, but throughout our world. But it certainly comes down that we have to have an open conversation with our doctors and with our patients, and we have to become advocates for ourselves, advocates for our family members, and really ask the questions, push for the testing, and if diagnosed, push for the clinical trials or the other new and novel ways of treatment that may be beneficial to you, because often we don't really want to have participation in those trials. And so we have to make sure we understand the benefits of those trials and make sure their options are available to us as well.